Diagnosis of jaundice. So now I want to look at the various ways you can use to diagnose jaundice, okay? From the clinical examination to what? Laboratory test. So for diagnosis of jaundice, you should just know that first of all, you have to access the history and examination. So you have to know that's history taking, physical examination before lab test. So you have to ask the person, when did the jaundice start? What are the other things you are feeling? Are you feeling fever, abdominal pain? Is your skin itching you? Pale stools, dark urine, and the rest of it. So you also look at risk factors: neonatal age, hemolysis, hepatitis exposure, and the rest of it. So physical examination, this is where you now look at the yellow skin, confirm. Signs of liver disease: is the liver enlarged? Okay. Fluid in the stomach, spider angiomas, and the rest of it. They also look at the signs of hemolysis, which is what? Splenomegaly, pallor, and the rest of it. So laboratory investigations, you now do the serum bilirubin fractionation. You distinguish unconjugated from conjugated high levels of bilirubin, okay? You do all those liver function tests, complete blood count. That one, you just want to look at how much of how will I put it, red blood cells were broken down, okay? So coagulation profile, you want to also still see how the person is being able to coagulate. Then other tests, like you do all those viral tests, that's if you are suspecting viral hepatitis. Then you also do autoimmune markers. This is where you are suspected that probably is the body's immune system that is fighting the own body cells, okay? So urine and stool examination, this is where you try to look at the urine and stool to see if the urine is dark or if the stools are pale, okay? So imaging studies, you look at the liver to see if there's any issue. You look at the spleen to see if there's enlargement. You look at all the organs in the abdomen though to see if there's any complication. Alright, so this is what we have for the diagnosis.